HSG, the fancy name for that is a hysterosalpingogram test, is a test to evaluate the fallopian tubes, or the connection between the ovaries and the uterus. The fallopian tubes are where fertilization of egg and sperm occur. And so for women or couples who are planning on undergoing inseminations or having intercourse after treatment to become pregnant, we need to ensure that that passageway or the fallopian tube is open so that the egg and sperm can meet normally. So the hysterosalpingogram, or the HSG procedure, is an X-ray test where water-soluble dye is placed inside the uterus through a speculum, and an X-ray is obtained to make sure that dye flows into the fallopian tube and then out the end of the fallopian tube, indicating that it is open. So it is a procedure to test for the patency or the openness of the fallopian tube. So we use, it's a plain X-ray film using something called a C-arm or fluoroscopy that gives us a real-time image of the dye passing through the uterus. So the great news about that procedure is you come in for the procedure, it lasts about 15 minutes, and you get the results the same day. Any woman who would like to evaluate the status of her fallopian tube, or really any woman who is planning on undergoing fertility treatment, should have a test to make sure that their fallopian tube is open. And the reason is that a blockage in the fallopian tube prohibiting the egg and sperm from meeting is one of the most common causes of infertility. So it's important that any couple undergoing infertility treatment understand that their fallopian tubes are open. The exception to that would be couples that absolutely have to have in vitro fertilization for some other reason. Because in vitro fertilization does not involve the fallopian tubes, we do not need to evaluate the status of the fallopian tubes in those women. Certain types of blockages in the fallopian tube are treatable with surgery. However, in an era when IVF is quite successful, it is a decision and a discussion between the woman and her physician, or the couple and their physician, about whether they would like to proceed with surgery to attempt to unblock or surgically correct the fallopian tube, or if they would like to bypass the fallopian tube and have a treatment like in vitro fertilization. And that will depend on many factors. Again, the age of the woman and how much time we have for fertility treatments, as well as other fertility testing. For example, if this couple also had a problem with the male factor infertility and a problem with sperm, that particular couple might be better off having in vitro fertilization rather than trying to surgically correct the fallopian tube.